Imagine you're sitting in your living room, and a close friend looks across the table and tells you they no longer want to be alive. Your stomach drops. Panic sets in immediately. Your mind races to find the perfect words, and underneath it all is a terrifying fear that saying the wrong thing might make the situation worse. This diagram illustrates exactly what keeps people quiet during those painful moments. For 73% of people, the primary barrier to seeking help is stigma. Stigma builds an invisible wall of silence. In many Hispanic and Latino communities, that wall is exceptionally thick. Cultural expectations often frame mental health struggles as a deeply private taboo, something to be kept inside the family and never discussed openly. Now think about the person sitting across from you. If they have thought through that cultural pressure to speak their darkest thoughts aloud to you, they have just performed an act of immense, exhausting bravery. The hardest step is already done. They broke the silence. Now your focus is simply to catch them. You must start by listening without judgment. It is human nature to want to jump in and solve the problem. You will feel a strong urge to list all the beautiful reasons they have to live, or to offer advice on how to feel better. Suppress that urge. Let them speak and just absorb their pain. Look at the message in this image. Tener depresión no es un signo de debilidad. Having depression is not a sign of weakness. Using this phrase reminds them that depression is a health condition that requires care, rather than something they should feel ashamed of. Next, remind them they are not alone. A mental health crisis is incredibly isolating. It convinces the person suffering that no one understands, that they are completely isolated, and that their pain is a heavy burden to everyone around them. You have to explicitly shatter that isolation. Look them in the eyes and say it out loud. We are in this together, and I am not leaving your side. By combining active listening with clear validation, you tear down the wall of stigma. You go from feeling like a panicked bystander to becoming a safe anchor for someone caught in a storm. Finally, you can act as the bridge to professional help. Navigating a mental health crisis doesn't require a medical degree. Your responsibility is simply to connect your loved one to the people who have that training. This graphic displays your two most important tools. On the left is the 988 Lifeline for emergencies. It is available 24/7, completely free, with fluent Spanish counselors. On the right, for those who prefer texting, use the crisis text line. Text Ayuda to 741-741. Many people hesitate to use these tools out of fear, so let's be clear, reaching out is strictly confidential. Calling these numbers will never impact a person's immigration status, and no one will ask you for insurance. Connecting to these resources brings in a team of trained experts to help you navigate the next steps. You no longer have to carry the weight of their safety all by yourself. Listen to them without judgment. Tell them out loud, you are not alone, and use 988 to bridge the gap to a professional. Surviving a crisis starts with human compassion. With all these tools in mind, you are prepared to face what might be the scariest conversation of your life. You know how to help. Save the numbers 988 and 741-741 into your phone today. When you help someone break the silence, you perform a life-saving intervention. This has been Wisdom for Your Day. Share and follow for more.